Today I will mention medication interventions for self-regulation in adults with ADHD and ASD. Deficits in self-regulation can have a significant impact of quality of life for people with ADHD and ASD. Current treatments for both conditions have limitations and do not specifically target self-regulation. Mindfulness practices offer a promising avenue to manage this, but it's unknown how well this would be received in ASD and ADHD. Therefore, our aim is to assess existing mindfulness practices and preferences regarding body scan meditation. And we have 157 ADHD and 132 with ASD UK-based participants aged 16 and 35. And they filled out an anonymous survey on Qualtrics. And content of survey from demographics, medication, adherence, and diagnosis checklist, and mindfulness experiences and level and acceptance willingness of body scan meditation. When we look at our results as demographics, we have female and a white dominated sample, the most frequently reported age group of between 21 and 25 years old. And when we look at the mindfulness experiences, most individuals had no prior experiences with medication. And when we look at the duration of the practices, they were practicing less than 1 month and once or twice a week. And while we found high level of willingness in ADHD, we found moderate levels of willingness in ASD. And when we look at preferences for using meditation as an approach to management, and as a standalone treatment, the most preferred frequency was 1-2 times per week, and as additional treatment, the frequency was reduced. And for support methods, most with ADHD selected a professional class, and the method was the least chosen in ASD. And exactly opposite results, ASD people preferred app for BS meditation, and which lowest number of ADHD people chose this method. And when we look at the significant positive predictors for willingness, and for ASD, they were total ASRS score and the availability space of meditation. And for ASD, that was the mindfulness level. And when we look at the discussion, actually ADHD people chose a professional class. This is maybe because of their core symptoms, for example, planning and organization. And ASD people selected a mobile app due to deficit, maybe social behaviors and anxiety. And thank you for listening, and I'm waiting for questions for Q&A.